Understanding blue balls causes symptoms and relief. The term blue balls is a colloquial expression that many have heard, often mentioned in jest or casual conversation. However, it refers to a real, though generally harmless condition known medically as epididymal hypertension. This condition can cause discomfort or pain in the testicles after prolonged sexual arousal, without ejaculation. While it's not a serious medical issue, the pain can feel intense for some, and understanding its causes, symptoms, and remedies can help demystify this often misunderstood phenomenon. What is blue balls? Blue balls, or epididymal hypertension, occurs when a man experiences prolonged sexual arousal that does not culminate in orgasm or ejaculation. During sexual arousal, blood flow to the penis and testicles increases, causing the penis to become erect and the testicles to swell slightly, by about 25–50% in size. This is a normal part of the body's response to sexual stimulation, as arteries expand to allow more blood into the genital area, and veins constrict to maintain the erection. If orgasm and ejaculation do not occur, the excess blood can remain in the genital region, particularly in the epididymis, the coiled tube behind the testicles that stores and transports sperm. This buildup of blood creates pressure, leading to a sensation of heaviness, aching, or even sharp pain in the testicles. Despite the name, the testicles rarely turn visibly blue. A similar phenomenon, sometimes called blue vulva or throbbing crotch syndrome, can occur in women when prolonged arousal without orgasm leads to discomfort in the vulva or clitoris due to blood congestion in the pelvic region. Symptoms of blue balls. The primary symptom of blue balls is testicular pain or discomfort, which is typically described as a dull ache or heaviness in one or both testicles, sensitivity or tenderness in the scrotum, a feeling of pressure in the groin area. The pain is usually mild to moderate, though some men report more intense discomfort, especially after prolonged arousal. Symptoms generally last from a few minutes to a few hours, though rare cases have been reported to persist for days. Unlike other causes of testicular pain, blue balls is not typically accompanied by swelling, redness, fever, nausea, or abdominal pain. Is blue balls dangerous? Blue balls is not a medically serious condition and does not cause long-term harm or damage to the testicles or reproductive system. However, the intensity of the pain can vary from person to person, with some finding it merely uncomfortable and others describing it as excruciating. It's critical to distinguish blue balls from more serious conditions that cause testicular pain, such as testicular torsion, a medical emergency where the testicle twists, cutting off blood supply, causing sudden severe pain, swelling, and potentially nausea or vomiting. This requires immediate medical attention. Epididymitis. Inflammation of the epididymis, often due to bacterial infections or sexually transmitted infections, STIs, like gonorrhea or chlamydia, accompanied by swelling, redness, or fever. Testicular cancer, rare but may present as a lump, dull ache, or swelling in the scrotum. Inguinal hernia or kidney stones. These can cause referred pain to the testicles, often with additional symptoms like abdominal or back pain. If testicular pain is severe, persistent, lasting more than a few hours, or accompanied by symptoms like swelling, redness, fever, or nausea, it's essential to seek medical attention immediately to rule out these conditions. Why does it happen? The mechanism behind blue balls is relatively straightforward. Sexual arousal triggers the parasympathetic nervous system, causing vasodilation, widening of blood vessels in the genitals. This increased blood flow leads to engorgement of the penis and testicles. Normally, orgasm and ejaculation act as a release valve, allowing blood to flow out of the genital area as veins relax. Without this release, the prolonged congestion of blood in the epididymis and surrounding tissues can cause discomfort or pain. Certain factors may increase the likelihood of experiencing blue balls, including prolonged arousal, extended periods of sexual stimulation without climax, such as during edging, delaying ejaculation intentionally, youth or inexperience. Blue balls is more common in younger men or those who are more easily aroused, such as teenagers. Individual sensitivity. Pain thresholds vary, and some men may feel more discomfort from blood congestion than others. How to relieve blue balls. The good news is that blue balls is easily manageable and relief is often quick. Here are some effective remedies. Release. The most direct way to relieve blue balls is through release, either via self-stimuli or consensual activity. This allows the excess blood to flow out of the genitals, reducing pressure and discomfort. Distraction. Engaging in non-arousing activities such as reading, watching TV, or listening to music can help reduce excitement and allow blood flow to normalize. Cold compress or shower. Applying a cold compress to the scrotum or taking a cold shower can reduce blood flow by causing vasoconstriction, narrowing of blood vessels, which may alleviate pain. Exercise. Activities like jogging, push-ups, or lifting heavy objects can divert blood flow from the genitals to other muscles, providing relief. Over-the-counter pain relievers. For more intense discomfort, medications like ibuprofen, Advil, or acetaminophen, Tylenol, can help reduce pain or inflammation. Breathing exercises. Deep breathing or techniques like the Valsalva maneuver, pinching the nose and lips while forcefully exhaling, may help reduce vascular pressure in the testicles. Urinating. Emptying the bladder can reduce pressure in the pelvic area, sometimes easing discomfort. Myths and misconceptions. Despite its prevalence in popular culture, blue balls is surrounded by myths. One common misconception is that the testicles turn significantly blue, which is rare and usually subtle if it occurs at all. Another harmful myth is that blue balls is a medical emergency, requiring adult activity to resolve. This has unfortunately been used as a pretext for coercion, with some individuals pressuring partners into putting out to relieve the pain. Studies, such as one published in 2023, have shown that some women report being coerced into certain activities due to their partner's claims of blue balls, highlighting the importance of consent and communication. Blue balls is not an excuse for pressuring anyone into this kind of activity, as the condition is manageable through solo methods like autoerotic release or non-arousing remedies. Think of your grandma and grandpa in a Speedo or bikini. Additionally, there's a lack of extensive scientific research on blue balls, with only a few studies and case reports available. This has led some to question its legitimacy, but medical experts agree it's a real, albeit benign, condition caused by temporary blood congestion. When to seek medical help. While blue balls typically resolves on its own, persistent or severe testicular pain should not be ignored. Consult a healthcare provider if pain lasts more than a few hours or worsens. Pain occurs without arousal. Symptoms include swelling, redness, fever, nausea, vomiting, or a lump in the scrotum. There's sudden intense pain, which could indicate testicular torsion or another emergency. A doctor may perform a physical exam, blood or urine tests, or a testicular ultrasound to rule out other conditions. The emotional and social context. Blue balls can be more than just a physical experience, it can carry emotional weight. Some men may feel embarrassed discussing it, while others may experience frustration or discomfort in some situations. Open communication with partners and a clear understanding that blue balls is not a medical emergency can help alleviate unnecessary pressure or guilt. It's also important to recognize that intimacy and personal well-being are natural aspects of overall health, and seeking advice from a healthcare provider or specialized therapist is a valid step if the condition significantly impacts one's quality of life. Conclusion. Blue balls, or epididymal hypertension, is a real but harmless condition caused by prolonged intimate arousal without ejaculation. While it can cause discomfort or even intense pain in the testicles, it typically resolves within minutes to hours through release, distraction, or other simple remedies. By understanding the difference between feelings and facts, such as recognizing that the pain of blue balls is temporary and not dangerous, men can manage the condition effectively without falling into myths or harmful behaviors. If the pain persists or is accompanied by other symptoms, seeking medical advice is crucial to rule out more serious conditions. Ultimately, blue balls is a manageable part of human physiology, and with the right approach, it doesn't have to be a source of worry or distress. By Scott Young, aka Synfamous Gamer,